pain spread from the brain? Pain is the most common reason for people to seek medical care. Sometimes it is easily possible to pinpoint what is causing a person pain. But, 1 in 5 persons who suffer from persistent pain cannot easily identify the cause. Whenever someone experiences pain, they often think about how intense the pain is, but rarely do they consider how widespread the pain is. Researchers from University of Michigan Medicine tried to find out what underlies widespread pain and published in the journal Pain on the 11th of August 2017. Richard Harris, Associate Professor of Anesthesiology and Rheumatology, is the senior author of the study. They examined data of 1,079 participants of Chronic Pelvic Pain Research Network study. They compared participants with a clinical diagnosis of urological chronic pelvic pain syndrome to pain-free controls and to fibromyalgia patients. Surprisingly, many of the individuals, in addition to having pain located in the pelvic region, had pain also widely distributed throughout their body. The widespread pain, thought to be a marker of centralization in the nervous system, originates in the brain. So, researchers submitted the participants to undergo functional and structural MRI of brain. Interestingly, they found that urological chronic pelvic pain syndrome patients with widespread pain had increased gray matter, when compared to pain-free controls. Such patients with increased brain gray matter volume also showed increased brain connectivity within sensory and motor cortical areas and functional connectivity involving the sensorimotor and insular cortices. These individuals with widespread pain, although they had the diagnosis of urological chronic pelvic pain, were actually identical to another chronic pain disorder, fibromyalgia. The team notes the changes in brain gray matter volume and functional connectivity were identical to outcomes present in fibromyalgia patients, but were not seen in the pain-free control group. This study represents the fact that pelvic pain patients have characteristics of fibromyalgia. Not only do they have widespread pain, but also, they have brain markers indistinguishable from fibromyalgia patients. This type of study will help treat these patients because if they have a central nerve biological component to their disorder, they are much more likely to benefit from targets that affect the central nervous system rather than from treatments that are aimed at the pelvic region. This study provides physicians with the opportunity to look at new ways of treating chronic pain patients, as there might be similarities across pain conditions if both show widespread pain.